During this episode, we spend time with Shani Bocian, founder and CEO of Allergy, an innovative telehealth startup aiming to improve the lives of allergy sufferers through personalized prescription nasal sprays. Born from Shani's mission to enhance the health of others and her father's 30 years of allergy research at Stanford University, Allergy provides customized relief by combining medications to target individual symptoms. While together, Shani explains how Allergy's approach helps chronic allergy patients who struggled with over-the-counter options and brings specialized care to those unable to access in-person allergists. We also explore Allergy's rocket ship growth, serving thousands of customers in just 1 year, and how Shani has taken the company to the next level. With an unrelenting focus on patients' allergy health, Shani and the Allergy team are pioneering much-needed innovation in a $15 billion industry. Join us as she shares her vision for leading change in allergy care nationwide. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Shani. A big welcome to our podcast today.
Thanks for having me, Mike.
Well, given your personal mission to help people improve their health and the company you founded to do exactly this, can't wait for our conversation today. But before we dive into our discussion, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcast. Lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Shani, it's almost time for our community to learn how you and the Allergy team are improving the lives of chronic and seasonal allergy sufferers with personalized prescription nasal sprays. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
I would say that there are always going to be people who immediately dissent, and there are always going to be people who immediately agree. But the most helpful conversations that I've had and that I think people should gravitate towards are the ones where you get pummeled with questions. The more questions that you get asked and you can answer that spur you to think of new ideas and do more research, the better. So find those people who will ask you those questions and you'll never get tired of them.
I absolutely love this. And I actually haven't heard this piece of advice on the podcast yet. Here's what I love. I love the naysayers. Some people, it drives them nuts, right? I love the naysayers. I love bringing those questions to test assumptions, to test the theories of whatever, companies that I may be advising or be a part of, or the company that we're going to talk about that you're building, of course. But I love those naysayers because it challenges our own assumptions, right? And at the end of the day, we need to ensure that our blind spots are being taken care of in order to build an impactful and sustainable business. And so therefore, for me, again, I embrace the naysayers. I love the questions. Is that something that is part of the culture and the team as well that you want to share with your teammates? Hey, go ahead, bring the assumptions, test everything. Do not just take yes for an answer. We need to make sure that we're always asking questions to get better. Is that part of your culture as well?
Absolutely. We have this phrase, ABT, always be testing. And that is basically to say, challenge your assumptions about everything, whether that be who's our target customer, how do we advertise to our customers, what's the best branding and tagline, how do we refine our offering and our customer experience. Everything that we do has to be tested. And I think a lot of our assumptions from the beginning turned out to be wrong. And we only learned that and learned how to improve them through testing and questioning.
Well, I know in a moment, we're going to talk about the assumptions and the tests that proved right about the exciting company that you and the team are building. We're going to unpack all of that and more after we get back and thanking our community champion sponsor.
Located in Denver, Colorado's nationally ranked River North District, Catalyst is a healthcare innovation campus that brings together stakeholders from across the industry to accelerate innovation and drive real, lasting change our nation desperately needs. from established organizations to startups, from accelerators to advocacy organizations, and from medical schools to global companies. Everyone at Catalyst works side by side to create, develop, refine, and bring to market cutting-edge innovations that will fundamentally transform healthcare as we know it. With industry leaders like Medical Group Management Association, Olive, Medical Solutions, UC Health, Cirrus MD, and many others calling Catalyst home, along with innovative pioneers visiting from across the nation, Catalyst continually fosters their foundational belief that collaboration and partnerships will move the healthcare industry forward. To virtually tour Catalyst and claim your space on campus or host an upcoming event, visit catalysthealthtech.com or visit the top of the episode notes and click on their link.
All right, we are back with Shani Bocian, founder and CEO of Allergy. Shani, thank you so much for setting the stage at the front end. I love it. That's a lot of the assumptions out the gates about your company were wrong, and you went and tested those theories, and you found the ones that were right, and now you got one heck of a company on your hands. We're going to talk about the company in just a moment, but of course, we want to talk about the journey that led up to founding the company. How did it come to be in the first place? Can't wait to hear that story. We'll discuss current state, how things are going today, where things are going tomorrow, what our audience should be thinking about, what you're seeing kind of being in that captain's chair with your organization and being an expert in the space. And then, of course, how we can help you as well. But first, Shani, take us back. How did this all come to be in the first place? Where were those aha moments? Share with our community how it all came to be.
So Allergy launched in September of 2022. So we're just about a year old right now, but really the company started about 30 years ago in my father's clinic in Palo Alto, California in the early 1990s. So my dad is an allergist. And when he started practicing allergy, he realized that there was a major problem with existing allergy medication. They were one size fits all. They each served a single and different purpose, each active ingredient. And while they were pretty okay for the mild and occasional allergy sufferer, they didn't really offer the severe and chronic allergy sufferer who was coming into his office sufficient enough relief. So my dad, he's an MD, PhD, he's a scientist by training. So of course he began researching and tinkering to solve this problem. And eventually he invented a radically more effective approach to treating chronic rhinitis in his patients. And what this entailed was taking multiple individual nasal medications, changing the dosages of those medications depending on each patient's unique set of symptoms and severity, and then combining them into the same single formula. So what he started doing was writing out complex lab instructions for his patients to purchase these ingredients at the pharmacy. And then he would say, take a teaspoon of this and 3 tablespoons of that over your kitchen sink and do your own chemistry at home. And soon my dad actually became famous for this. His name is Robert Bocian, and his protocol became known as Bocian's Potions around Stanford in the Bay Area. So he did this for 30 years. He treated tens of thousands of patients who were doing their own chemistry at home. He trained his fellows at Stanford in how to teach their patients how to do this method. Fast forward to about 2021. I knew what my dad was doing. I'd been using Bocian's Potions for about 10 years myself as a chronic allergy sufferer. I was basically an expert in his method. I taught my friends to mix up their own nasal sprays. I think, I taught my boyfriend at the time how to do it. He's my husband now. I think that had something to do with it. And I started to realize that while Bocian's Potions was extremely effective, there were some major limitations. First of all, either me or my dad had to teach someone how to do it. It was really disjointed. It was time consuming. It was error prone. It was complicated. It was expensive. And it was isolated to people in our community. So when I came across this statistic that rhinitis is actually a leading chronic disease, and as many as 100 million Americans, most of them chronic and severe, suffer from this condition, I realized that there was this really cool and incredible business opportunity to take Bocian's Potions and formalize it to build a scalable business around what my dad had been doing in clinic for the last 30 years. So the mission then became, let's bring custom prescription multi-ingredient nasal sprays to the masses and change the face of allergy care in this country.
Wow. And of course, I was personally excited to spend time with you because I wanted to hear the story of your father, because I'm also part of the Stanford community. And I'm so glad to hear that one of our fellow Cardinal has been doing such amazing work in our community. Bocian's Potions, I absolutely love it. So Shani, this is amazing setup in regards to the conversation we're going to have around the organization that you launched, Allergy. So let's first but go back in just a moment and talk about in time, when you started seeing the big business opportunity, did you think, oh my God, I'm going to be a founder of a healthcare innovation company? And was that even part of your roadmap in and of itself, coming out of school, starting your career? Like, did you see that as part of your roadmap?
At the time I was getting my master's in education. I was at Brown. I was studying to become a teacher and a researcher in the education space. I was deeply unhappy in that career. I loved kids, loved teenagers, but was honestly a terrible teacher. I just wanted to hang out with my students. I hated grading them and testing them and disciplining them. And so I felt like in a lot of my spare time, I was trying to think of ways that I could make myself happier, change the world, have a kind of macro level impact on the world in a way that I wasn't getting from my career trajectory in teaching. And it was really just in parallel that, I was in Providence. My dad was in Palo Alto. I was having terrible allergies and I bought all the ingredients and mixed them up. And then I started doing it for a friend and then another friend. And then I started talking to my dad about the science and it blossomed from there. And it just felt like a natural pathway into building this business, but it was never part of the initial roadmap.
Gosh, how excited it is. Amazing how these things end up working out for themselves. So let's go to current state. Let's talk about Allergy. Who is it? What are you guys are building? And more importantly, how are you doing this work at scale? Because, spoiler alert, there is a little bit of a technology play here. So I can't wait to talk about it as well. But who is Allergy? What are you guys up to? And how are you doing this at scale?
So Allergy is a telemedicine and personalized medicine company. The way that it works is if you are a rhinitis sufferer or you have chronic or seasonal allergies, meaning you have symptoms of nasal congestion, inflammation, runny nose, postnasal drip, itching, sneezing on a regular basis, whether that be every day or during your allergy season. And Mike here is raising his hand. It's actually 1 out of 3 Americans would also raise their hand. It's an extraordinarily common disease. So if you fit that picture and you are looking for relief that is safe and effective on a daily basis, then you sign up for Allergy. And after you sign up, you go through a medical questionnaire. We ask you dozens of questions about your medical history, your symptoms, your severity, what medications you've used, what's worked, what hasn't worked. We go as deep as, what does your mucus look like when you blow your nose? Is it green? Is it clear? We get gross. But based on all that information, our team of allergists, who were all trained by my dad in his protocol, can then create a custom nasal spray formula for you. And that nasal spray formula will have up to 4 medications in it that are each customized in their dosages to match your symptoms, severity, and medical history. And then that ends up being the most optimal nasal spray for you that you can use daily, that will treat all of your symptoms in one bottle, that will be most efficacious for you. And the fact that it's custom means that as the season changes or as your body changes or as the weather changes, we can change that formula by adding or removing ingredients, by changing the percentages of certain ingredients so that you're constantly getting the most optimal relief for your symptoms.
Wow, that is absolutely powerful. So Shani, let's talk about those results with the end users. What has it been like? How are these patients, how are these consumers first enjoying that telehealth console, right? We've seen telehealth explode out of necessity during the pandemic. My hope and dream is that we continue our path on leveraging telehealth. I think it's a fabulous modality to help patients at scale. So first of all, how are the patients, how are the consumers responding to that? And then of course, how are they enjoying these new medications that are applicable to them, that are designed for their issues? How's the experience been?
So our target patient is someone who has moderate to severe rhinitis, who is currently using at least one allergy medication, probably a nasal spray, and who's dissatisfied with that medication. This is someone who's probably not seen an allergist. And the only reason for that is that most allergy sufferers haven't seen an allergist because there are only a couple thousand in this country, but we have over 100 million allergy sufferers. So this is someone who needs expert care, who until now has gone to the drugstore and seen a shelf full of medication, or really an aisle full of medication, but not really known what to pick, has gone through quite a bit of trial and error, and has essentially self-treated. And being able to access online expert care, Stanford level care from a rural area in the middle of the country where the nearest allergist is 350 miles away, or someone who has never thought to see an allergist, but really would benefit from that expert level care, us being available online at the click of a button, and then not even having to schedule a synchronous visit, but being able to do all of this asynchronously from your bed, at home on your own time in the middle of the night when you're up because you can't breathe, has really been beneficial. And then in terms of the patient and how they've benefited from this, absolutely. So we're taking people mainly who are currently using allergy medications who aren't getting the relief that they need, either because they have way too many side effects or the relief is just insufficient. Our primary patient has pretty significant nasal congestion. And one of the issues with current medications is when you take a medication like a nasal steroid, which are super commonly sold, and you spray that into a congested nose, it's not going to go very far. But really, the real inflammation that's causing the nasal symptoms happens very high and deep into the nasal passages. So one of the things that we do at Allergy is we take a micro dose of a decongestant, a teeny tiny dose, and we add that to our formulas. And what that's been proven to do is open the nasal passages so that the other medications that we include, which are the anti-inflammatory, the antihistamine, the anti-discharge, can get much higher and deeper into the nasal passages than any of those sprays on their own. And so that's why our patients get better. And that's why they choose to switch to Allergy and switch off of their previous meds.
Very exciting. Love the feedback. That's always important, right? We can always go and build companies that we think are good and going to bring value to the marketplace. But at the end of the day, it's the end user that matters most. So great to hear that those patients and those consumers that you and the team are serving are finding that relief. So let's go a little future state. Let's grab the crystal ball off the shelf. Let's look a little down the road here, Shani. What are you and the team seeing on the macro in the next 2 to 3 to 5 years in this space? And then, of course, kind of at the intersection of that, where is Allergy going to be as well in those next few years?
So the nasal spray industry in this country is a $15 billion industry. Most of it's over the counter. It's just huge. But the dissatisfaction rate is incredibly high. And it's growing because more and more people are starting to suffer from allergy. Allergy seasons are getting much more severe. Medications that used to work aren't working well enough anymore. And so our goal for Allergy is to become the frontier of the nasal spray industry and to really become a leader in this space. We are the first custom prescription nasal spray in the world. We are the first nasal spray in the world to have more than 2 active medication ingredients. And so this is real innovation in a very niche and specific place. And by staying so niche and specific within nasal spray, we think we can make significant leaps and become a leader in the space.
Very exciting. And as you continue to see as well, it sounds like that telemedicine, that technology piece is crucial to continuing to build at scale. Do you see that continuing to expand? I mean, is this a potential global play as well? I mean, this seems like this can really grow in regards to reach for some of those consumers and patients that you could serve.
Our goal right now is to serve every single American who needs Allergy. And we think that there are tens of millions of you out there.
Yeah, there are certainly a lot. And just staying focused here just alone, there's going to be a huge business opportunity in and of itself. So very exciting kind of future state of where things are heading and seeing the opportunity of serving that niche market that you guys are going after. So we'll put the crystal ball back now for the time being. Let's bring it back to current state. I know you guys are continuing to build the organization. We have an amazing community rallied around this podcast, some industry leaders that always love to help our guests out. What's one problem, need, or question that you and the team have that our community can be helping you with?
We've served 15,000 customers in the last year since launch. We are a multi-million-dollar business just 1 year since launch, and we are now ready to take our business to the next level of growth. And so we're embarking on our next fundraise to help fuel that. And if anyone is listening who finds this to be compelling and an extremely unique consumer business with rocket ship growth, extreme capital efficiency, we've only spent $2.5 million to date doing what we've done, and a really scrappy, passionate founding team, then we would welcome outreach.
Oh, I know there's a lot of folks out there that are on the investment side of the aisle that tune in. So in order for them and their friends and associates to get a hold of you, where do they find you online, social media handles, contact points, websites, or otherwise? How do they find you to have those conversations?
You can sign up for Allergy and try it for yourself at www.allergy.com. We do a free first month trial. You can find me at Shani at Allergy.com, Shani at Allergy.com. We're on LinkedIn, we're on Instagram, we're on TikTok.
Yeah, that's plenty. Okay, well, we'll leave all of those contact points in the episode notes. So for all of our listeners, simply scroll on down into the episode notes to find those contact points. Of course, you can head over to our free global online community at passionatepioneers.com as well. There will be a post for Shani's episode where you can find all those contact points and leave comments and feedback for her team as well. Again, over at passionatepioneers.com. Well, we're going to wind this down for now. Shani, we are excited to continue to follow your story. We may have to have a Where Are They Now conversation a year from now for year 2 and 3 of the organization. But for now, as we wind down, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I wake up every day and the first thing I think about is how our patients are breathing.
Absolutely. I love that. And knowing that you guys are serving them time and time again, what an exciting mission. And so glad to have you take a time to be with our audience, share the story, and share the growth that's happening within Allergy. Can't wait to continue to follow that story. I know our community is going to be excited to reach out to you. So again, Shani, thank you so much for being with us today and sharing all the wonderful things happening within your camp.
Thanks so much for having me.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.